Hello everyone. So in this video, I'll discuss about the expected topics for Gpat 2026. Now, for pharmaceutics, recently a new pharmacopoeia was introduced for 2026. So this can be an expected question this time, which includes nearly 121 monographs. So a question from a pharmacopoeias can be expected, and there is no questions from posology or allegation method in the last year question paper. So this time we can expect a question from posology, allegation method, proof spirit, or isotonicity. So focus on the problems on the MCQs or problems on these topics. And guarantee questions will come from every year from the topic of schedules, particularly from jurisprudence, those board members, acts, and everything. So focus on this. And guarantee questions will come from these tablets, capsules, and aerosols, and focus on particularly the excipient, different excipients of tablets and their particular points, unique points will be there. Na? Again, for tablet coating, capsule manufacturing sizes, the tablet defects, in process quality control test, which includes this hardness, weight variation, etc., those specifications and everything, and the capsule machines. So cover all these topics. So you can expect a question from these topics. And from aerosols, questions from container parts, evaluation test, and propellant classification. This is very, very important. We can expect a question this time. And questions from urology, micromatrix, and suspensions. So these three are very important topics in physical pharmacy. We can expect 3 to 5 questions from these topics. So read everything about this Newtonian, non-Newtonian flows, the micromatrix, suspensions, and everything. So moving on to the chemistry part. So this time we can expect a gunshot question from Woodward-Fisher rules and HPLC stationary phases and normal phase, reverse phase, and the source and detectors of UV, HPLC, GC, and MS. So these are very, very important. This time we can expect a question from this topic again. So focus on all named reactions. If you are facing some difficulty in named reactions, just remember the starting material, the reagent or catalyst, and the product. So this may help you to people. Let's say for example, in which reaction the starting material is alkyl halides, the reagent is sodium plus dry ether, and the product are alkanes. So like this you can remember the named reactions. This might help you. And for the point of chemistry, heteroisomerism is very, very important. So frequently in NIPER, questions from heteroisomerism will be asked, particularly for biphenyl compounds. And the stability orders for conformation of cyclohexane and butanes. So this stability order is very, very important. The chair, twisted boat, and everything. For look at the order of everything. And this limit test for iron, very important. This time we can expect a question from limit test also, the ppm limits and everything, and U transitions, red shift, blue shift. So this time we can expect questions from particularly analysis part, all the UV, HPLC, IR, and everything. So keep a point on that. And aromaticity, and then SN1, SN2 reactions. So these are the main topics which I have to cover for from chemistry part, and focus on biochemistry also. All these cycles like a TCA cycle, Krebs cycle, glycolysis, etc., and then enzyme deficiencies and everything. And for pharmacognosy, so in pharmacognosy, there's nothing to read much. Just have a look on alkaloids, glycosides, and tannins, their classifications, their drugs and their families, their common names and everything, and the types of stomata, the basic stomata and everything. The traditional system of pharmacognosy include Ayush, Ayurveda, Yuddha, Sinani. So only unique points are enough. And for the point of pharmacology, just focus on the drug classifications. So try to study every classification mentioned in the KD3 party book. And anti-Parkinson's, CVS classification, antibiotics classification, very important. And from general pharmacology, this time a sure short question we can expect from human teratogenic drug tables and clinical trials, enzyme inducers, enzyme inhibitors, ADME studies, etc., and anti-epileptic also. So these are the main important topics to be focused in GPAT 2026. And also I have made some videos previously from all the important topics of different subjects, including pharmaceutics, pharmacology, and chemistry. So have a look on those all videos which are in my YouTube channel. So Be prepared, be consistent. Thank you.